All right, good morning. Thank you all for joining us here today. I'm Nathan Fletcher, County Supervisor and Chair of the San Diego County Board of Supervisors. There are some tragic truths that we need to be honest about and we need to take action to confront. One of those is that Black infants are 3 times more likely to die and 60% more likely to be premature than white infants. Black mothers are 3 times more likely to die because of pregnancy or delivery complications. To address these obvious inequities, the County of San Diego Health and Human Service Agency today is launching its Black Legacy Now education and outreach campaign. 2 years ago, the governor of California authorized statewide funding for perinatal equity initiatives. In this time, and even before where we are now, Dr. Wooten, our public health team, staff from Health and Human Service agencies, and members of the community have been working diligently for years to close the gap of perinatal health inequities in the Black community. The task in front of us is to take up that work and continue it with even more focus and more resource and more support. Black Legacy Now is a bold, proactive initiative to make sure that Black infants, mothers, and families are prioritized, and there are long-term solutions to lift them up and ensure access to equitable health and equitable opportunity to live healthy lives. We have to work together to overcome decades of systemic racism to build a legacy of opportunity, access, and generational support. Structural racism is not something that 1 or 2 individuals or 1 or 2 institutions choose to practice. Instead, it is a feature of the social, economic, and political systems in which we all exist. The original sin at the founding of our country was that of slavery, and from then until the present time, intentional government policies have created the racial inequities that we continue to see manifest in so many different ways throughout our society, including issues of infant mortality and infant health. And so because of this, there is an obligation. It is vitally imperative that we have to intentionally work to put in place systems and policies to build anti-racist institutions. We have to work to build policies that are put in place to make sure that public policy that affects communities of color, especially the Black community, who are disproportionately impacted, have disproportionate access in an attempt to catch up, to fulfill the basic promise of fairness. I don't believe there's anything in the notion of the American dream that connotates equality of outcome, but it absolutely 100% requires equality of access. And equality of access means that every child in every community in every area has an equal shot at a healthy and thriving life, and we do not have that today. And that's why we are here today, is to begin to change this and to begin to put in place policies that acknowledge the obvious, but don't just acknowledge it, but take proactive steps to make it better. Dr. Wilma Wooten, our health officer, will be here shortly to walk you through the details of how we will do that and the details around the Black Legacy Now campaign. But before she does, I just want to touch briefly on some actions that the Board of Supervisors have taken just this month, a part of what we call our framework for the future. And what we are doing here today with this policy fits in with a new direction that the Board of Supervisors has taken. It started on January 12th by the Board of Supervisors declaring racism a public health crisis. But it wasn't just a declaration to make a statement or make a point. It was about fundamentally changing how we as a Board of Supervisors guide our county. The action we took empowers the county, it requires the county to allocate funding and priorities and policies in an equitable, data-driven way, to take policies to support change in historically marginalized community, to direct our measurements of success on outcomes, not as a totality, but are we bridging that divide in terms of equity and investing where it ought to be. The efforts here today to support better health outcomes for Black mothers, babies, and families is right in line with a new direction that our entire county government is moving. And as we move forward, I will be working closely with the team that are doing this to know what they need, what support, what actions, what funding, what personnel. The team that is going to be leading this know exactly what to do, and they've been doing it for many years. Now the burden is on folks like myself to make sure that we are supporting their actions with our prioritizations and with our policies. We are committed as a county to requiring racial and equity data be used for prioritizing funding. We're committed as a county to creating a process for community input on policies and practices that might lead to perpetuating racial or ethnic disparities. We are revising the county statement of values, mission, and strategic plan to represent equity and inclusion at our core principles. We, moving forward, will be requiring an equity impact statement in every action that gets brought before the Board of Supervisors so we can be honest about what is this policy doing. Is it going to have a positive impact, and where is it going to go? And we are improving data collection to identify racial disparities amongst programs and services meant to improve health, social, economic, educational, and criminal justice circumstances. That is a commitment our Board of Supervisors has made, and the action today is one that is not only one that should be praised, but one that we must continue to support. And so I'm incredibly pleased to join this effort today and to see our county beginning to move